thing President Obama did tonight in the healthcare arena? That's the big story in the country right now, and that is the subject of this evening's Talking Points memo. First of all, President Obama's intentions are good. He wants to clean up the healthcare mess. That's hurting millions of Americans. What's wrong with that? Nothing wrong with that. But his plan is chaotic and the expense ill-defined. But the president sees great urgency.
This debate is not a game for these Americans, and they can't afford to wait any longer for reform. They're counting on us to get this done. They're looking to us for leadership, and we can't let them down. We will pass reform that lowers cost, promotes choice, and provides coverage that every American can count on. And we will do it this year.
I think my head is going to explode. I don't know what he said. Now, I'm not being a wise guy. I've often said the government needs to control the medical industry, a lot of oversight. But after another hour of Barack Obama explaining his program, I still don't know what it is. The man is incapable of breaking it down so that we, the people, can understand it. That's the crux of the matter. It's supplemental. It's elemental. It's whatever mental you want it to be. It's crazy. If President Obama wants Americans to support an overhaul of the health care system, he's got to put it in bullet form. Like, remember Ross Perot? He's got to get the chart. So we know what's going to happen and who's going to pay for it. Otherwise, this is not going to fly. And that's a memo. Now, for the top story tonight, is the president losing the support of the folks because of the health care fog?
If somebody told you that there is a plan out there that is guaranteed to double your health care costs over the next 10 years, that's guaranteed to result in more Americans losing their health care, and that is by far the biggest contributor to our federal deficit, I think most people would be opposed to that. Well, that's the status quo.
Continuing now with the president's press conference this evening, with us, Dick Morris, the author of the very big best-selling book, Catastrophe, hit #1 on the Times list, which deals with Mr. Obama's policies. Okay, I don't want to be obnoxious about this, but you saw the opening. I don't understand what he's talking about. Do you understand what he's talking about?
Yeah. You got to read into his vocabulary. It requires a redefinition of the English language.
Let me stop you there. Do you think most Americans are reading into his vocabulary? Okay, look, just treat me as a guy from Levittown. All right, I'm making $55,000 a year, okay? And I want to insure my family of my wife and 2 children. Is Obama's plan going to help me?
No. Obama's plan is going to kill you.
Well, how is it going to kill me?
Because it will take away your doctor's ability to decide what care to give you.
Okay.
How old are you when you're in Levittown? Are you over 65?
No, I was 5.
No, I mean now I'm saying.
Okay, I'm not telling you how old I am.
No, I'm saying the
just
typical
stop. Okay, so you say that I'm in Levittown, 55K, 2 kids and a wife, that now I lose control over what procedures can be performed by my doctor because the government says yes or no. That's number 1.
Precisely.
Okay. Do my health insurance premiums go down?
No. Your health insurance premiums go up because you have to pay for the cost, one way or another, of insuring 50 million people that aren't covered.
So how do they go up? Do I have to pay more? Do people take money out of my check?
Your employer
yes,
either has to give you health insurance.
Right.
Or he has to pay 8% of your income.
But that doesn't affect me.
Obama said that health care is gobbling up the money that employers should give to their workers. Well, he's gobbling up 8% of it.
Okay, so you're saying that it'll cost me money because I won't get a bigger raise? Because my employer will have to be paying for extra health insurance for me. But it's worth it if I don't have to pay for it.
Not for you.
No, for everybody else.
For the 50 million other people.
All right, so that's a theoretical argument, not a direct argument. Okay. Now, my health insurance in Levittown is through my employer, Fox News, okay? And they give me it. So can I go to the doctor I want to go to?
Oh, yes, you probably can.
I can. I can keep my doctor.
But your doctor can't make the decisions he wants to make.
You just said that. Okay.
Yeah.
So he has to check with the feds.
The Federal Health Board, which has never met you, is going to decide whether you can get a hip replacement as opposed to your doctor.
My health records, which are now in the hands of my private physician, and nobody else sees them.
Right.
My health records, they're going to be in Washington, right?
Yes, absolutely.
So every malady that I have is going to be seen by people in Washington, right? I don't want that. Do you want that?
No. No.
But are you sure that's going to happen?
Of course, it has to happen.
Why?
Because they have to design protocols of care and ensure that they're being implemented
All right, so it's
across
going to
the
say
board.
William J. O'Reilly, all right, Polo Lane, Levittown, has the following conditions.
What they're going to do is collect the data about William J. O'Reilly. I never knew the J part. And then they're going to put that together with all the other stuff and come up with statistical data as to who in the country has what. And based on that, they'll model who ought to get what treatment.
But on a computer disk in D.C. will be what's wrong with me.
Yes.
Based on what my doctor's history, my medical history.
Right, next to your Social Security
That makes
number.
me very, very nervous. Okay, now, next question. And these are simple questions that I need to have answered. Okay.
That's cool.
So, he says, President Obama says, that when they get through in Congress, it's not going to add to the American debt. We're on the verge of bankruptcy now, as everybody knows, all right? But this will pay for itself.
Yeah. First of all, nothing in health care has ever paid for itself. Secondly, the Congressional Budget Office, which is bipartisan,
CBO.
expert, incredibly well-informed, has gone through each of these cost savings he's talking about and refuses to score them, which means they refuse to say, this will save $100 million, this will save $50 million, this will save $10 billion, because they don't believe that there's any proof that that savings is going to take place. And when he says he's determined it's not going to add to the deficit...
So what do you think?
Charlie Rangel's bill, which he's working with, has $550 billion that he can't account for how he's going to pay for it.
So you think that over $500 billion in a 10-year period will be added to the debt we already have?
I can't be sure it's that. Oh, yeah, $500 billion, yes.
All right, that's a lowlight.
Over.
Now, in your book, Catastrophe, then you list a number of unintended consequences.
Right.
For example, doctors and nurses not being paid as much as they are now in the private system will leave the practice.
They'll stop practicing.
Right. They'll become lawyers or something like that.
Which means there'll be less and less medical care.
Fewer medical professionals. Are you sure that would happen?
Of course. First, it's happened in Canada. Secondly, if you're cutting medical incomes, that's going to drive doctors out of medicine. When he says he's going to cut medical costs, there are only two ways to do that. Cut the money that doctors make.
Well, he has to do that. Because that's one of the big drivers.
And that means fewer doctors. And cut back the care that patients are allowed to receive.
Can he cut the price of drugs because the government will buy them en masse? Won't drugs be available to us for cheaper?
Yeah, they can. That's a good thing that he can
that's
do.
a good thing.
And
so it's not all bad.
And he can require generic drugs for brand names. He can do that. That's good also.
Okay.
But those savings are already factored in before we get to the $1 trillion over the next 10 years that this thing is going to cost.
Now, some conservatives on the radio particularly don't want any intrusion into the health care system. Yeah, they say, leave it alone. Yeah. That's insane.
Well,
you've got to do something.
Well, first of all, Bill, there are 50 million uninsured people, okay?
Right.
10 million are illegal immigrants who are going to get covered under this thing. This thing essentially takes care from the elderly and gives it to immigrants.
Why does it take care from the elderly?
Because if you're going to ration medical care, who's not going to get the hip replacement? A 40-year-old or an 80-year-old?
So if you're old, he won't get it because some younger person who might be illegal will get it.
And a quarter of our health care dollar is spent in the last year of a patient's life. And that's where they're going to cut it. It's the duty to die.
So the life expectancy you expect to drop in the United States under good?
Yes, absolutely.
Right. Okay, Morris.
Just like in Canada, the cancer death rate is 16% higher.
Higher than here. All right. Morris's book, Catastrophe, deals with a lot of stuff very specifically. Thank you. I understood everything you said tonight.
Good.
Don't agree with it all, but I understood.
You know why? I went to Columbia.
Yeah. Don't brag about that.
It's better than Harvard.
Directly ahead, Dr. Mark Lamont Hill, another brilliant man, has a different view of the president's press conference tonight.